GEEKS in full is growing expertise in e-health knowledge and skills, and normally focuses on capacity building. This is like a fellowship program for health informatics professionals working with the Ministry of Health, mainly to strengthen their skills in health information systems. The projects we carry out are around immunization. The Ministry of Health, that is UNEP, proposes priority areas that needs to build capacity for their health informatics professionals or the data people. The three areas that the ministry proposed for this particular cohort of GEEKS was customizing and utilizing the EIDSR system for VPD case-based reporting. And the second project was about coming up with innovation to improve defaulter tracking for under-immunized children. The third area was mainly improving data quality and use for routine immunization data. We have different stakeholders from the DHI, that's the Division of Health Information, UVRI, that is Uganda Virus Research Institute, and even HISP Uganda. We have also some of the district level people, normally to add in the context of what happens at the district level or the sub-national level. Over 22 GEEKS mentees have been trained in those different aspects, and those are different sub-projects they work on.
Group 1's objective as GEEKS Cohort 1 was to customize EIDSR and utilization of case-based data.
It has been really a good, successful project, and so many things have been achieved.
I've learned primarily two things. First, on the programming side of things, I've got a better understanding of vaccine preventable diseases and their management. Specifically, that's measles, rubella, and polio, where I've got to understand the kind of information that is collected and how it can be analyzed.
We've been having a lot of entry workload. So with this EIDSR, we shall have reduced workload at the lab. Feedback will be timely. Also, the district people will have lessened the time of waiting. Like, for example, if there's missing information.
With GEEKS, we have been able now to develop our own tool. Of course, it is not legalized to be taken on already as yet, but at least now you can know if you're going to carry out a DQA, how can you develop a tool or questionnaires to fit a particularly issue that you're going to address.
I've also had some mentorship in the ARA programming language for statistical computing and data visualization, where I've got to use it in extraction of data from the EIDSR system, manipulating it and uploading it to another system.
The skills I gained with Power BI and R have enabled me to gain the ability to perform advanced data analysis on large data sets, and also gain valuable insights and trends in different data sets, mainly measles and AFP data.
GEEKS has supported me in using the EIDSR because initially we were using a PIN4, but of course I've learned so many other skills.
Power BI has enabled me to create custom visualizations of dashboards and reports for mainly measles and AFP data.
As a program, we cannot wait to know where the children who are not immunized are getting.
We had different innovations to pilot. Particularly, a very exciting innovation was the tickler system, which is mainly just a shelf with appointment cards that are moved into different shelves that are documented or written on the different months. So an appointment card is put into a shelf of a month that a person is expected to come up. So you would easily notice if it's in February, you can easily notice that those are the defaulters or people who are expected to come up.
The mechanism for some of the communications that we have to do is grounded around epidemiology. So it is important that you people remember but also expand on your epidemiological knowledge, starting from those basics you are able to do. Because if you don't, the information that you would have analyzed, there's a whole field of research endeavor where we talk about communication of insights. After you have gotten your insights here, how do you transmit it? How do you communicate it coherently so that the people who need to understand what you have understood with your data knowledge can understand it as well?
I want to say congratulations and colleagues who have participated on this year-long journey. Thank you very much for persisting and ensuring that we have something to show to case today.